Elisa with JustOrthopedic.com, and I'm talking here today with Dr. Jesus Rey with Southwest Orthopedic and Sports Medicine. Are you doing okay?
Yes, Elisa. How are you?
I'm doing wonderful. Well, we all know that you are absolutely the shoulder expert around town. Tell us about some of the injuries that you see pretty frequently and how you treat those.
Yeah, the elbow is kind of that forgotten joint, we always say, because we have a specialist in hands and they usually stop just above the wrist, and then you have shoulder specialists and they usually stop above the shoulder, and so the elbow is kind of that forgotten, that lost child that not everybody wants to take care of. But mainly the elbow is a very unforgiving joint. What I mean by that, elbows get very stiff and they can produce a lot of debilitating symptoms for the patients. So elbow injuries tend to occur usually at a younger age, and gradually they start getting worse over time. So by the time that somebody reaches the age of 45 or 50, they can have significant contracture, which is a lot of stiffness in the elbow. And those patients can, not shave. Women cannot reach their heads. So they can produce quite a bit of morbidity for the patient. So those patients require some treatments. Way back when, still we do this kind of surgeries, but we have changed the way in which we approach the elbow, and we can do different procedures like releases that before would require a very extensive approach. Now we can do it through tiny little incisions, and with cameras we're looking exactly as to where we need to be, and we release those tight tissues sequentially, and that allows for the patient to restore their mobility and their function, and those patients tend to be extremely happy. Another problem that we see is injuries, usually due to a fall. Most fractures that occur about the elbow are the result of a falling from a height, and most patients that I see are either in the workers' compensation group, because these tend to be either roofers or the occasional, patient that is cleaning the gutters, right after the fall, and then he falls right off a ladder and hits the elbow on the concrete or against something that breaks the elbow. Those fractures are very complex to treat, and you want to get to those injuries rather quickly because of what I just said. You want to get them moving fast. You want to be able to restore the anatomy, and otherwise the patient may not have a good outcome. So you want to get to them rather quickly.
Well, I think that the elbow is certainly a joint that we probably take for granted until all of a sudden we don't have functionality of it. So it sounds like the treatments that you have for the elbow truly do work. So
absolutely correct.
We appreciate you being here with us again today. Here with Dr. Jesus Rey with Southwest Orthopedic and Sports Medicine. Elisa here with JustOrthopedic.com, and don't forget to check us out on Facebook, LinkedIn, and Twitter.